Hi, my name is Leeanne Salois. My student ID is E3050881, and this is my AVMA task video for lab animal. Alright, so for this video, I'm going to talk a little bit about rat husbandry and some general stuff to do with them. Their cages need to have solid bottom with wire outsides and wired ceilings so they don't escape when their feet don't get hurt on any other bottom. You want to make sure water is fully available for these guys. They have little water bottles with a nozzle on them for them to drink out of. Food, they usually eat pellets or seed. You can commercially buy them at any kind of pet store. You can offer them fruits and veggies as well for snacks because they really love those. For temperature, these guys need to make sure the temperature in the room is about 65 to 75 degrees Fahrenheit with the humidity about 40 to 60%. For IDs, they have ear tags, especially with the lab animals in large groups. You can microchip them. They have temporary IDs with non-toxic colored markers. They can also be tattooed as well, especially again when you have large colonies. In a clinic setting, usually we have cage cards and we identify them by name, breed, or their coloring. For enrichment, you want to make sure these guys have plenty of toys and things to chew on, especially for their teeth to make sure they're not overgrowing. They like wheels. They have things they can climb in, under, and around in case they want to hide or bury. Now I'm going to talk about restraining for rats. For some restraint techniques, you can actually scruff them just like you would normally a cat to kind of hold them. You can also hold them at the base of their tail, ensuring that you're not going in the middle because you can actually hurt them and deglove their tail, which can be pretty painful to these guys. If they're pretty docile, you can usually just hang on to them and they'll sit pretty still. Now I'm going to talk about reproduction and how to identify the genders for your pet rat. Gestation for these guys is about 22 days, and they usually have a litter of about 6 to 12 pups. They are spontaneous ovulators they're continuously polyestrous. In order to tell the difference for sexing, you're actually just going to turn them over. Males will have actually large testicles, while females have a little slit right here. So this little lady is a female, and you can see right here where her vulva is. The next thing I'm going to do is I'm going to give this little girl a sub-Q injection, which is going to be right under the skin. So the best thing to do is either have someone help you or you can scruff them. I'm going to take my syringe, take the cap off. I'm going to make a tent of their skin. Hi, baby. Stick the syringe in. I'm going to pull out, make sure I don't have any blood, and then push the medication in. The next thing I'm going to do is I'm going to perform to show you guys how to give an oral dosing to rats. Again, if you want to scruff them, this is usually the easiest thing to do. I'm going to take my syringe with some water. I'm going to stick it in my little girl's mouth and then give her medication. Good job. And there you go. Next, I'm going to be performing a blood draw on a rat. So we're going to use the bottom of their tail. And first, I'm going to put some alcohol near the area. I'm going to take my syringe. And there you go. All right, so this is Pete, our little mouse, and I'm going to talk to you guys about basic health care procedures for these guys and taking care of them. It is important to have a solid bottom cage with wire lids inside so these guys don't escape. Make sure you have soft and absorbent bedding so their urine and feces kind of absorb in it. You want to make sure the bedding is dust free and is non-toxic to these guys. You want to make sure the temperature in the room is at least 65 to 75 degrees Fahrenheit with a humidity of 40 to 60%. You also want to make sure you have happy enrichment things for these guys to play with so it keeps them going happy and go lucky. You want to make sure you have things for them to hide under, go over, bury themselves in the extra bedding. Having wheels to run around, it's always really fun for these guys. Sometimes the little tubes from the toilet paper, they love those too to run in and out of. For identification purposes for these guys, they have ear tattoos where you can tattoo their ear to identify them, especially if you have a large colony of these guys. You can actually microchip them, which is kind of cool. They have non-toxic markers to mark them as well. In a clinic setting, usually they have cage cards with their name, breed, color, date of birth. For nutrition wise, usually they're fed a seed-based diet. You can usually leave the food out, but you want to keep an eye on these guys because they do have a tendency to overeat. And water should always be available for them, so to make sure they keep themselves hydrated. When handling a mouse, you want to be very, very careful because they are pretty fragile. You can either scruff them behind their neck to restrain them. You can also grip them at the base of their tail as close to the body as possible, being careful not to pull on the tail or watching the skin. We don't want to deglove them because it can slough off. Or if they're pretty docile and calm, you can usually scoop them up and hold them pretty nicely. Next, I'm going to talk about reproductive and how to determine sex with these guys. For reproduction, these guys are spontaneous ovulators with they're continuously polyestrous. Their estrus period is usually 4 to 5 days. Their gestation for them is 19 to 21 days with an average litter size of about 10 to 12 pups. To determine whether they're a male or the female, you can scruff them, turn them over, and view the bottom. Males usually have larger genitalia, and they're kind of pretty obvious on mice because they're pretty big and noticeable. The females will have a little slit here, and that usually will be their vulva. Next, I'm going to show you how to administer drugs and medication using appropriate sites for these guys. I'm going to do 2 injections. One is going to be a sub-Q, so under the skin, and then the other is going to be an intraperitoneal injection. So you usually can use someone to help you give these, or if the mouse is pretty docile, you can usually do it by yourself. With the sub-Q injection, we usually use small needles. I'm going to lift some skin just like tenting. I'm going to insert the needle under the skin. I'm going to pull back to make sure I don't have any blood, and then I'm going to inject my medication. Next, I'm going to give an IP injection. For restraint purposes, you want to have them scruffed on their back with the tail tucked between your fingers. Usually you can do this by yourself, but sometimes you might need someone to help you. You want to give your injection into the lower left abdomen on the lower quadrant because usually there won't be any internal organs near that area. So I'm going to take my needle, I'm going to inject right into the mouse. I'm going to pull out, making sure I'm not hitting the urinary bladder or anything, and then injecting in. Good job, bud. Next, I'm going to be performing an oral dose on a mouse. So what I have is a little small syringe with some saline in it that I'm going to use. I recommend scruffing the mouse because they're usually a little bit better restrained that way. I'm going to take my syringe, I'm going to insert it in their mouth, as much as they want to tolerate, and insert the medication. Good job, bud. So in this video, I'm going to talk to you a little bit about rabbit husbandry. These guys need a solid bottom cage with a wire top. You want to make sure they have water available in a water bottle at all times. They can actually be litter box trained, so you want to make sure you get a little litter box in there with some paper bedding. You want to make sure you avoid the clay, cat litter, or wood shavings because sometimes the rabbits will actually eat them, so you want to make sure they're not in there. For food wise, these guys are herbivores, so you want to make sure they have a variety of grass, leaves, and all that kind of stuff. There are commercially available foods you can buy at the pet store. You can also give these guys veggies, but you want to make sure you keep them light because they can actually become overweight and they don't really have any nutritional value. Regarding identification, things you can do are microchip them to kind of establish who they are. They can actually tattoo their ear. In a clinic form, we usually use cage cards or identify them by color. Enrichment, toys, things for them to chew on to make sure their teeth don't overgrow. This is a good little example of that. For when you're restraining a bunny, it's very important to stay quiet and calm because these guys really react to loud noises. And if you're kind of high strung, they're going to be a little high strung. They like to be close to your body at all times, sometimes with their head covered. Picking them up, you want to make sure you scoop from the back so their legs do not kick out because they can actually become paralyzed if they kick too hard. Scooping their head and keeping it covered usually keeps them safe and secure. Other ways is you can actually roll them over on their back and they actually stay pretty calm that way. It's kind of nice. Hey, baby. This is a good thing for when you're having to cut their nails. It's okay, sweetie. Or if you have to clean their underside. The next thing I'm going to talk about is the reproductive and then how to determine sex on your rabbit. These guys are induced ovulators with a gestation of about 29 to 35 days. And they usually have a litter about 4 to 12 kits. To determine male or female, you're going to turn them on their back, and actually this is a little girl, and you can actually tell by putting a little bit of pressure on their lower region. You can push and a little vulva will actually pull up. And with males, they'll actually be a little bit more swollen here because they have their testicles. So this is a little girl. Next, I'm going to be showing you how to give a subcutaneous injection for your rabbit. You're going to take your syringe, take a tent full of skin. You're going to insert the needle in, pulling back, making sure you don't have any blood or anything else, and then push your medication in. And then rub the area afterwards. So for the next video, I'm going to show you how to get blood out of your rabbit's ear. It's nice to have someone holding the rabbit so they're not too stressed, keeping them on the table. I'm going to take a cotton ball with some alcohol on it, rubbing over the vein to clean it off as well as to make the vein more appearable. I'm going to take my syringe, insert it in the vein, sorry, baby. And draw back. There you go. Thank you. In this video, I'm going to talk a little bit about bird restraint and understanding how to restrain a bird when they come in, especially for nail trims, wings, all that kind of stuff. The best thing to use is a towel to cover them, especially when we have small birds like this, because they can chew on them and you have a little bit better grip. So you want to hold, put your one finger on top of their head and your thumb and your pointer finger right under their eyes, not pressing on their eyes. Also keeping your palm of your hand with the bird in your hand, making sure you're not putting any pressure on their chest area because that will restrict their breathing. The next thing I'm going to do is show you guys how to cut some toenails on these guys. You want to make sure you have quick stop available because any loss of blood is a very bad thing for them. You can use cat toenail trippers. I really like the suture scissors because they work really well. So let me get him on. No, you're gonna have to come home. So you can either, sometimes if the bird's pretty well maintained, you can you do it yourself, but the best thing to do is have someone hold so you're not stressing the bird out. So with your clippers, cut each little toe, being very careful to avoid the other toe, especially when you have small birds. All right, and go to the other foot. What a good bird. And there's the nail trim. The next thing is when a bird comes in, you want to be able to look at the bird and decide if there's anything going on. So you want to check their beak for length. If it's overgrown, you recommend to the owner that it needs to be clipped. Check their nails to see if they need to be trimmed, their wings, asking the owner if they want them to fly, not fly, kind of basing on what they want the bird to be able to do. Checking their coat, their feathers, making sure it's all intact, to make sure they're not plucking or there's anything going on at home causing them stress. Checking them kind of overall, check their eyes for any discharge, ask the owner how they're eating, they're doing well, making sure there's nothing stressful going on in the house.